So welcome everyone to today's webinar on a very important subject: to achieve equitable and inclusive and quality pharmaceutical education for all, and the launch of the FIP toolkit for addressing inequities in pharmacy education. Hello, I am Ralph Altieri. I'm the Dean of the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences in the US, and chairperson of FIP Education. I need to run through a few housekeeping tasks, an overview of the program, and then we'll provide adequate time for our speakers and panelists, so I'll keep my remarks as short as possible. So a few announcements here. As you can read on the screen, this webinar is being recorded and live streamed to YouTube. The recording will be available on this website, www.events.fip.org. Please use the Q&A box for asking your questions, which we will get to after we hear from our speakers. You're welcome to provide feedback. We would like you to provide feedback so we can keep improving the quality of our programming and other ideas you may have for programming for FIP at that website. And of course, we encourage you to become members of FIP and become full participants and contributors to what FIP provides to the world of pharmacy. Okay. So this is an overview of the program that we'll be doing today. So after my initial remarks, why achieving equitable, inclusive, and quality pharmaceutical education is important. Then an overview of the toolkit. Then we'll have individual speakers speaking on various aspects of inequities in pharmaceutical education, recommendations for how we can address these inequities, and then a self-assessment tool and campaign materials for addressing inequities in pharmaceutical education. That's when we'll have time for our Q&A session. Again, please put your questions preferably in the Q&A box. And then we'll end with a panel discussion and then wrap up and closing. And I'll be introducing the speakers as they come forward for their remarks. So our learning objectives, you can see on the screen here, learning about the vital inequity themes that impact pharmaceutical education, understand the importance of having equitable pharmaceutical education, and discuss with toolkit authors and high-level speakers how to take action towards enabling equitable pharmaceutical education, both within your country, your region, and of course, globally. I'd like to thank all of our contributors to the toolkit that we will launch today that will provide guidance for all of us to address inequities in pharmacy education and provide better opportunities for all. So thank you for all of the contributors, the time and the expertise that you have provided for this toolkit. So inequities in education and pharmacy education specifically has been a persistent problem in all corners of the world. And of prime importance is the inequities in the opportunity to even access education, both generally and for pharmacy education. Inequity has been embedded systemically in education systems. We all know that's been made even worse by the COVID pandemic. And recent studies have suggested that there's been a loss of 2 years of education progress, certainly in children, but probably also in our own pharmacy education institutions that has resulted from the pandemic. And of course, we know that that loss of progress was not evenly distributed across the student population. But those from low income environments, those who are minorities, fared much worse than others during this COVID pandemic, and certainly for the inherent inequities that we have. So there are numerous factors that go into inequities in pharmacy education, and we'll hear from our experts about those factors and get some ideas of how we can address these inequities and provide greater opportunity for all. With that, I'll end my remarks so we can move on to our speakers and our panelists. So it's my pleasure now to introduce Ms. Nilhan Uzman, who is the lead for education and primary healthcare policies at FIP. I've had the pleasure of working with Nilhan for at least 5 years now, I think, Nilhan, at FIP, and I have great respect for her knowledge and skills in pharmacy education. And she will address why achieving equitable, inclusive, and quality pharmaceutical education for all is important. So Nilhan, welcome.
Thank you, Ralph. Thanks for your kind words. And welcome everybody to our launch event. Good morning, good afternoon, or good evening. I've seen many different countries in our participants list, so we are very excited to have you. Also, I would like to thank our speakers for being with us today. So I'll give a brief overview of why we have done this toolkit, what was our supporting arguments, and trying to address inequities in pharmacy education. Can we go to the next slide? So the role of education is central to advancing pharmacy and pharmaceutical sciences to meet the needs of our populations. And as the International Federation, Pharmaceutical Federation, FIP, we agreed with the World Health Organization that there is no healthcare without a health workforce. And as FIP, we add on to that there can be no health workforce without inclusive, equitable, and quality education. The United Nations Sustainable Development Goal, SDG 4, quality education, it aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. And to achieve SDG 4, UNESCO's 2021 Global Education Meeting Paris Declaration emphasized that there is an urgency of tackling the educational crisis and inequalities exacerbated by the COVID-19 pandemic. The impact of COVID-19 on higher education further broadened the inequities and unfairness that exists with regard to inclusion in, access to, and quality of higher education. And also recent evidence and findings from FIP's research indicated to us that inequities exist also in pharmaceutical education, also elsewhere in our practice, and they need to be addressed urgently. And for that, FIP's development goal, FIP DG 10, Equity and Equality, and our dedicated program, FIP Equity RX program, which aligns with and supports both United Nations SDG 4 and the Paris Declaration, set a transformation agenda for global pharmaceutical education stakeholders in developing clear strategies for addressing inequities and diversity inequalities in pharmaceutical workforce development, continued education and training and career progression opportunities. In the next slide, I'm delighted to announce that to strengthen our commitment as a FIP in investing in education for the future of humanity, for our planet, we have officially signed UNESCO's Paris Declaration and provided our official support in order to transform education and address inequities. And today, in the next slide, as an immediate action to support and show and demonstrate our support to SDG 4 Paris Declaration, of course, for our efforts in implementing the FIP DG 10, we are proudly launching the FIP Toolkit for addressing inequities in pharmaceutical education to motivate, assess, and inform forward-thinking changes to transform pharmaceutical education through addressing inequities. I encourage you all to use our findings, country cases, resources in this toolkit, so you can become a change maker in your country, in your region, in addressing inequities, of course, one step at a time. so we can achieve inclusive, equitable, and quality pharmaceutical education for all. And thank you very much. And now the presentations will follow with our authors and our panelists, so you'll get to know more about our toolkit and what's in it for you. And I'll hand over to Ralph now. Thank you very much.
Well, thank you, Nilhan, for giving us that global perspective that we then can bring back to our institutions to effect change. Our next speaker is Ms. Alison Ekukakpen, who's an education partnership specialist at FIP, and her home country is Nigeria, and she will provide us with an overview of the toolkit. Alison, welcome.
Thank you so much, Ralph, for that introduction. And thank you, Nilhan, for giving that perspective on why we need to achieve equitable, inclusive, quality pharmaceutical education. So I will be giving an overview of what's in this toolkit, and I invite you to listen and be expectant of the great content of this toolkit. As a starter, you can see here that this toolkit has 3 chapters, so it's really concise. It's something that you can cover in a very short amount of time with very useful resources for you. I would move quickly to tell you that the first chapter of this toolkit gives the background to the issue of inequities in pharmaceutical education. And this background, you would first of all see an introductory video that sets the scene for equitable pharmaceutical education. After the video, there is a follow-up article that gives you the reason for addressing inequities in pharmaceutical education, on why this is important. And then finally, but very important in this chapter, we have a collection of interviews from global stakeholders in education. In particular, we have an exclusive interview from UNESCO giving the global perspective on inequities in education. In addition to the global perspective, we have a series of interviews from the 6 WHO regions: Africa, Americas, Europe, Eastern Mediterranean, Southeast Asia, and Western Pacific. All these give perspective from the different regions on inequities impacting pharmaceutical education across their region. So this is what you will see in chapter 1. Then in chapter 2, we'll now delve deeper into the different aspects of inequities in pharmaceutical education. And for this toolkit, we've identified 4 inequity themes that impact pharmaceutical education, which our speakers will be addressing shortly. And just to let you know that these themes have been identified from major global guidance on inequities, including our FIP development goals, the UNESCO reports. And in this chapter, you would read articles, but also apart from the articles, you also see case studies, country cases of the real life implications of these inequities and how they are being addressed in different contexts. So listen forward in the upcoming presentations about addressing these themes, and please visit the toolkit for more and more vital information. And then we would go to the 3rd chapter in the toolkit. And we've given a background to inequities impacting pharmaceutical education in chapter 2. Now this chapter 3 gives you a set of resources on how to address these inequities. There are recommendations, there is a self-assessment tool, and also there is an additional resource, which are campaign materials that will be useful for you to adapt in addressing inequities in your context. So we kindly invite you to stay tuned during this launch, and at the end of the launch, visit the toolkit, make it useful for yourself and your context. Thank you so much.
Thank you, Alison, for that overview of the toolkit. It certainly is comprehensive, a lot of good information there. But we'll now turn to today's main event, which is the launch of the toolkit and our speakers on these various aspects of inequities in pharmacy education. Our first topic is gender inequities in pharmaceutical education. We have the next slide, thank you. And our speaker, we welcome Dr. Aysu Selçuk, who is the Education and Primary Healthcare Policy Specialist at FIP, and also a lecturer at Ankara University Department of Clinical Pharmacy in Turkey. So welcome, Aysu.
Thank you, Ralph, for your kind introduction. Today, I am going to talk about the chapter we developed together with Claire Thompson. We may go next slide, please. Okay. So the gender inequity is a worldwide issue that is increasingly being discussed in public. We also see gender inequity in pharmaceutical education. We categorize inequalities under 5 categories. So the first one is equal incentives for equal work. We know that in mid-career women, the salary of women academic scientists falls behind males. This gap has a large effect in terms of lifetime earnings of women. Mm-hmm. The second is the work-life balance, as women still typically have more responsibilities, including domestic activities such as cooking, cleaning, aged care, and child care. They must manage more activities than men. This might lead to a scenario where a woman is compelled to choose between their career and family goals, and something rarely required of male academics. The third one is creating supportive and safe working environments. The COVID pandemic has exposed the long-standing inequities for women who are affected by the additional care and housework. Due to these additional responsibilities, women lost their motivations and time to carry on research, and hence their stress level increased, causing some mental health problems. Next slide, please. The fourth one, can we go? Yes, thank you. The fourth one is opportunities for professional development, recognition, and empowerment. Although universities had equal opportunities and policy statements, these were less likely to be practiced. This inequality may be explained by the number of women in academia, which is lower than that for men in many countries. And the last one is women leadership. In academia, especially for pharmacy, despite having predominantly female students, gender inequalities in leadership positions remains. So in my next slide, I'm going to show you a list of interventions that can enable for achievement of women in education. For example, we may create diverse, inclusive, and respectful environments. We may eliminate gender pay gap, seek mentors and sponsors or mentorship to address underrepresentation for women in education. Paid parental leave, flexible schedules, remote working options can also help to improve gender inequalities in pharmaceutical education. So in my next slide, my colleague, Dr. Halat, also shared a case study about gender inequalities in pharmaceutical education. With known inequalities that the women are usually expected to exert performing tasks that are less rewarding or less recognized, making them shoulder the burden of low value or unpaid assignments. So more childcare during the pandemic was done by women compared with men. And for women in science, the pandemic has witnessed a decline in their publishing capacity of peer-reviewed scientific articles. So despite these challenges and problems, Dr. Halat says that in her institution in Lebanon, women in academic pharmacy are offered training, mentorship, and promotion roles equal to those of men, and based on only academic profile, scientific achievements, capacities, skills, and services to academia and the profession. So that's all I want to share. I will be happy to answer the questions from the audiences. You may write them on the Q&A box. Thank you.
Thank you, Aisu, for that presentation and for Dalal and her case study for these insights into the gender inequities and ways forward that we can take. Our next topic is the racial ethnicity and religious inequities in pharmaceutical education. Our speaker is Dr. Khalid. Whoops, lost my place here. Garba Mohammed, who currently is a postdoctoral fellow in pharmaceutical engineering group at the School of Pharmacy at Queen's University in Belfast, UK. He also is a registered pharmacist in Nigeria, having practiced in community and hospital pharmacy. So welcome, Khalid.
Hello, everyone. Thank you so much, Professor Ralph, for the kind introduction. And hello, colleagues. Thank you for joining us on this great event today. Next slide, please. Thank you. Well, I'm going to talk about racial ethnicity and religious inequities in pharmaceutical education. And from my own personal perspective and personal experience, I think first thing first, if you want to address racial, ethnic, and religious inequity in pharmaceutical education, the first thing to do is to acknowledge it does exist. Acknowledging it is existing is halfway into getting us addressing it. So let us stop living in denial that these inequities do exist. That is the first thing. And then there are several factors that have been associated with the racial, ethnic, and religious inequity in pharmaceutical education. For instance, there have been several reports on the lack of minority role models in the pharmacy school that actually have some impact on the student. I mean, they don't have someone to go to talk to. I mean, someone they consider as a role model. So that have an impact on their performance, for instance. And also there are issues, especially for the undergraduate student completing primary or secondary or high school in other country and then moving to another country to study pharmacy, for instance, have some impact due to cultural differences and also language barrier at some point. So these are some of the associated factors that are linked to the racial, ethnic, or religious inequities in pharmaceutical education. And of course, some of the factors that have been linked to these inequities include student performance. This goes without saying. The student performance, because some of the students find it a bit difficult to interact very well with the so-called majority group in the pharmacy schools, for instance, especially for the undergraduate. And then you find it also very difficult if you are talking on the bigger picture, the pharmaceutical workforce and public health impact. For instance, you have patients from different backgrounds. They may have different religious inclination. So if there are not enough manpower, pharmaceutical workforce that have been trained to kind of represent all the racial, ethnicity, and religious perspectives, there are some certain disease situations that have some inclination to the medication of the, maybe for instance, religious group. Fasting, for instance, you have Christian community, you have Muslim community that are fasting, for instance, in some certain situations. So their medications are related to the fasting, for instance. So if you have representation from the pharmaceutical workforce that can link and liaise or understand the patient situation in those cases, it can be very important issue to address in addressing this. And then way forward, of course, what is called, there is this inclusion, diversity, and equity in faculty recruitment, for instance, is one of the ways to address inequities in this regard. One, from the academic perspective, the faculty members, recruitment, there should be fairness, inclusion, and diversity, regardless of your background, as long as you have the requisite requirement. And then the student admission also, there should be this inclusion, diversity, and equity. This will help not only in addressing it, but at the same time, we should also give the atmosphere in helping this minority to achieve their full potential. And this goes to the next slide, please. Some of the factors that can be used to address these inequalities, for instance, the use of the cultural intelligence. There are 4 key domains to use in cultural intelligence to address or to achieve inclusion, diversity, and equity in pharmacy education. For instance, the first is cultural practice. This inculcates the use of communication skill, effective communication skill to teach our pharmacy students how to create dialogue, so as to create an inclusive environment during their education as well as after graduation. There is also this cultural desire to inculcate into the student and the staff the lifelong learning in pharmacy practice from the education background, And then the cultural awareness and cultural knowledge. These are two different and somehow similar, but in the case of cultural awareness, you make both the academic staff and the pharmacy student to understand that there is this inequity in racial, ethnic, or religious in their environment, and then how they can dive into addressing it. That is the awareness. And then for the cultural knowledge, it is more inclined to the student, pharmacy student, to inculcate into them to understand, okay, there are a certain group of people with respect to public health. There are some specific disease conditions that are more associated to those kind of people, so that we train the student to practice as a global citizen or global pharmacist, not only within their own domain, but when they graduate or they become pharmacists, to be able to practice globally everywhere. So in a nutshell, this is all I have from this perspective. And I would like to thank Professor Oliver from the University of Florida, with whom together we put together this section of the toolkit. Thank you so much.
Well, thank you, Khalid, for those insights into this area of inequities in education, and particularly pharmacy education, and for ideas for how we can move forward and help to alleviate some of those inequities. I'll move on to our next topic, which is resource-related inequities in pharmaceutical education. So we welcome Dr. Nilavani Padiachi, who is Senior Lecturer and Researcher in the Department of Pharmacy and Pharmacology in the Pharmacy Practice Division at the University of Witwatersrand in South Africa. Her area of expertise is strengthening health systems and improving medicine management and access. So welcome, Nilavani.
Thank you, Professor Rao. Welcome, everybody. Greetings to everybody present. I see we have guests from all over the world. Before I begin, I'd just like to thank my colleagues who were co-authors on this chapter, Ms. Zalna Booth, Ms. Rubina Sheikh, and Professor Yayo Chinara. Please, can you go on to the next slide, Alison? Thank you. Okay, so my discussion today is on resource-related inequities in pharmaceutical education. We know that economic growth is a key tenet in many countries, and to successfully achieve this, we need suitably trained and qualified professionals. Furthermore, to produce skilled professionals, pharmacy programs must be quality assured against the relevant standards, irrespective of the inequities they may face. Pharmaceutical educational resource inequities may be classified into four main themes: infrastructure, finance, human capital, and technology. So I'm going to start with infrastructural inequities. Students are exposed to different levels of infrastructural resources based on how well or poorly resourced the university is. The lack of resources such as libraries, lecture venues, laboratories become serious constraints, as we have seen in low to middle income countries, where the enrollments have increased in pharmacy programs, but the infrastructure remains the same, which compromises the quality of the program. Poor Wi-Fi connectivity, insufficient electricity, and the lack of computers impacts the delivery of the program, especially in the digital age that we are living in. There is strong evidence that shows high quality infrastructure facilities is linked to improved student outcomes and reduced dropout rates. Learning communication and counseling skills is an important skill to become a competent pharmacist. And yet in some LMICs, access to patients is a challenge for pharmacy students, which is part of the work-based learning program. Here we need stakeholder involvement between private and public sector to assist with this problem. Going on to financial inequities. Accessing in higher education in low to middle income countries, as shown in the case study from Nigeria in the toolkit, is a concern. students seek financial aid, bursaries, and scholarships to cover their tertiary education costs. However, with escalating costs, the funding they receive is sometimes insufficient. The COVID pandemic has underscored and perpetuated financial inequities in pharmaceutical education. In LMICs, the lack of access to Wi-Fi data, laptops, and paid digital learning resources left students feeling displaced, disconnected, and disengaged from learning. Furthermore, reduced government funding and budget reallocations impacts the quality of pharmaceutical education. Next slide, please. Human resource inequities. The shortage of suitably qualified and trained academic pharmacists is a growing concern and concerning inequity. This was shown by the case study from Turkey in the toolkit. The lack of qualified academics compromises the quality of the pharmaceutical program. Inadequate remuneration also poses a threat due to the lack of funds. Furthermore, academic institutions place more emphasis on research and not on teaching. Yet to achieve high quality pharmacists, we need skilled teachers. Technological inequities. New tools, technologies, and strategies that enhance learning is needed in the pharmacy profession as it evolves. However, the lack of financial resources, antiquated delivery methods, and tools are used in research and teaching in some low to middle income countries due to the limited access to technology. The COVID-19 further marginalized students by widening the digital divide. During COVID, remote learning became unnegotiable due to lockdowns, and unequal access to devices, data, internet connectivity, and the varied digital literacy amongst learners all posed a threat to the quality of the pharmaceutical program. Next slide, please. So what is the impact of inequities on the future of the pharmaceutical workforce? According to FIP, for pharmaceutical care, we need a competent trained workforce to achieve, and to achieve this, we need competent pharmacy academics. However, universities need to be resourced to make this a reality, as the lack of resources impacts innovation and the development of competent pharmacists. Additionally, one must bear in mind that low to middle income countries gear pharmacy students toward patient-centered care, while high-income universities focus on pharmacy specialization. While this is a needs-based approach, the difference in curriculum further exacerbates these inequities. Finally, I'm going to go on to the case study. Next slide, please, Alison. So it was a case study provided in our toolkit by Janelle Sabotka, and she's the FIP Foundation Director from the University of Cincinnati. And to my surprise, you know, I come from a low to middle income country and I was unaware of this. So that's why I chose this particular case study. And I hope it helps everybody here that's at this presentation. So the first program that's available is called the Pharma Bridge program, which is a FIP program which assists pharmacists from low to middle income countries by providing professional support from high income countries, programs, and organizations. And they support exchange programs and provide educational materials. This is a 4-week exchange program. However, this has been stopped due to COVID. But during that time of 2 years of COVID, we saw that education booklets were provided to registrants from low to middle income countries. The other option is the Innovation Grant, which is provided by the FIP Foundation and the FIP Young Pharmacist Group, which provides €1,000 for innovation in research to young pharmacists or pharmaceutical scientists with limited resources. It supports the implementation of the project and also allows them the opportunity to present at the most recent FIP conference. The projects must be directly or indirectly benefiting or to improving the health of communities and to demonstrate the value of pharmacy. Thank you very much. Thanks, Ralph.
Well, thank you very much for that overview of those infrastructure, financial, et cetera, issues on inequities. But I think your talk also brings together some of the issues from our first two, because the gender inequities, the racial inequities, ethnicity also helps to limit the number and the diversity of our academic workforce. So that starts to bring together these various issues that compound the inequities that we're seeing, and we need to address all of them along the way so we can improve the quality of education for our students and access as well. So thank you for putting that together. And I just might add the Pharma Bridge program, for those who don't know about it, you should look into it on the FIP Foundation website. We have participated in it before COVID, hope to do it again in the near future. And this is a great learning experience on both sides for us who are providing an opportunity for new learning and learning from the participants and what their issues are and how we can focus a learning experience for them. It's a great program. Please look into it. So our next topic is on education-related inequities in pharmaceutical education, and that'll be presented by Dr. Dalal Hamoudi, who's Associate Dean for Assessment at the Lebanese International University School of Pharmacy in Lebanon. Welcome, Dalal.
Good morning, good afternoon, good evening, everyone. Thanks, Professor Altieri, for your kind introduction. I would like to thank FIP for inviting me to be part of the authors for this toolkit and for launching. So I'm going to address in a few slides the education-related inequity, summarize how did we write them in our toolkit. Next slide, please, Alison. Thank you. So I will just be summing some of the data my colleagues have just presented, and I will also be highlighting education-related inequities. So globally, and according to data from the United Nations, about 17% of the world's children, adolescents, and youth suffer educational inequities, or in other words, they are out of school. And this makes a harmful sum of more than 250 million individuals if you go to the numbers. And of course, the problem becomes more perplexed and more deteriorated if you talk about the low-income countries. The results of such educational inequities, of course, include, among other consequences, inequitable access to schooling. So we mean here schools as well as colleges. We have low retention rate for students. So because of problems in commuting, resources, technology, financial, etc., students are not retained and we end up with low retention rates. And most importantly, there is disruption in the learning process. So actually, you can see that whenever we talk about global educational inequities and think about pharmacy schools, we can also relate that such inequalities can also exist in the pharmacy academia, and mainly will have consequences on the quality of education, the ability to become accredited or qualified students, the change we see in pedagogical approaches across schools of pharmacy within inequities. This also reflects not only on education itself, but also on the workforce. So if we don't have proper education and well-balanced pedagogy, we will not end up with good pharmacists. The consequences also cascade towards the public, who will not be exposed to well-educated pharmacists. And of course, this will affect health outcomes and the healthcare in general. So this is just if we look at inequities and we try to tailor what do we know towards pharmacy schools. In the next slide, I'm going to be a bit more specific. So next slide, please. A bit more specific about inequity aspects and constructs that we know in pharmacy education. So what do we know about inequity? What does literature report about inequity across pharmacy schools? We know that pharmacy schools mix students from different backgrounds, and students who are vulnerable will be more underrepresented, and this will alter their access to education and will alter the quality of pharmacy education they receive. Also, as my colleague just explained a few minutes before, there are sometimes resources that limit the access to education, whether it be technological resources, laboratories, instruments, classrooms, etc. There is also deficiency in technology in certain places, and this has been very widely exacerbated by the COVID pandemic. Individuals in low resource settings, individuals in rural areas, students who had during the pandemic to share households and small rooms with their families. Those were the most deficient in in having access to education and in being able to access the remote delivery platforms, the simulation technologies which were used during remote education. Also, as educators, we notice among our students the variable background in housing, in religion, in ethnic background, in socioeconomic status, in employment. We notice this very frequently among our students, and unfortunately, such inequalities affect the quality of education and at the same time affect the mental health of our students. Finally, there is a gender inequity, and this is very common not only in pharmacy education but elsewhere. My colleague Aiso has described a bit about gender inequity. I would like to add that gender inequity is also visible in pharmacy academia at the level of the C-suite or the higher administration, where like pharmacy touted to be a profession for females and thought to hold a balance between family and career. We see many inequalities. We see lack in female academics reaching high positions, and we see also gender inequity among our student females. So this being said, how can we move on? What is the future perspective? So next slide, please. What are the initiatives we can call upon or we can relate in order to try to reduce educational inequities in pharmacy? Actually, the FIP Developmental Goal 10 calls for equity and equality, so countries should have clear strategies to address equity and diversity in pharmaceutical workforce development, also in continuing professional development and in career progression. So this has been called upon, and this is a wide sector which we can look at. Recently, by the end of 2021, the Oath of Pharmacists, which is spelled out by recent pharmacy graduates, have been updated in order to include a statement for diversity, equity, and inclusion. So today, our new graduates do spell the sentence where they say, I will promote inclusion, embrace diversity, and advocate for justice in order to advance health equity. Maybe this can be a call forward so that institutions, policymakers, pharmacy schools become aware of the issues of diversity and inclusion and become more accustomed to like handling the issues of inequity in education. Next slide, please. So the following are some recommendations to mitigate education-related inequities in pharmacy academia. So if we call on for pharmacy schools should look for mental, physical, and digital resources that address inequity. They should also do assessment of the demographics of students. Let us look for students, graduates, and alumni who come from underrepresented groups and follow up their progress during pharmacy program. The schools also should look for partnerships in probably research centers, in pharma industry, etc., in order to mentor and provide good opportunities for the talented pool of students who might be underrepresented or vulnerable. Of course, all this will need funding to support the infrastructure, to support the technology, to support library and e-library facilities, to support research laboratories and other sources. We should seek student feedback and ask our students how they feel. We should look for students or groups who are at risk of mostly being vulnerable or highly probable to face educational inequities. And also this will require governance, and this will require the policymakers to continuously assess inequity, especially with the current changes occurring with the pandemic and with the different social and economic challenges the world is seeing. I will move on to the last slide in my talk, which I will describe a case study about education-related inequities that was kindly written by our colleague, Dr. Khalid Jarba Mohammed, who is joining us today. I have selected this case study from Nigeria because it represents a concrete example of inequity that occurred in this country and that directly affect pharmacy schools. So according to Khalid, he says that there are problems in infrastructure, in technology, and in human resources that is in his country and that affect pharmacy academia. At the same time, there was a big national strike for the academics, which resulted in closure of universities. So like students who wanted to have their pharmacy degree done in 5 or 6 years would have to wait for 7 or 8 years because there were continuous block or closure of the schools, which made students lose many of their study years. It suggests many strategies. For example, advocacy by pharmacy schools and national pharmacy councils for equity, also to collaborate, such as the FIP UNESCO unit twinning program among the universities. Also, he invites to involve key stakeholders, policymakers, ministers of education or higher education, and probably ministers of public health be involved in the process. Also to develop an infrastructure which is sustainable regarding the schools, regarding the staff capacity building and mentorship of the staff is very important. And finally, we should always call for research about educational inequities and how to address them. I hope our audience could benefit from additional country cases that are presented in our toolkit. And by this, I finish, and I'm happy later to take your questions. Thanks, everyone, and thanks, Professor Altieri.
Well, thank you very much, Dalal, for that really great insights and comprehensive look into these educational inequities, and also, again, bringing together all of the areas that we talked about already, and ways forward. And, you know, the advocacy part is extremely important in this process. So, as well as the research into it, so we have evidence that we can use in our advocacy efforts. So thank you very much for that. Now we next have a video message from Dr. Nasrine Morad, who's a clinical associate professor at the Lebanese International University. This is a voice-over PowerPoint presentation, so if we may start that, thank you.
Good morning, good afternoon, and good evening. Thank you, Professor Ralph, for introducing our video, which is a glimpse about education in times of humanitarian crises. The United Nations defines humanitarian crisis as a singular event or a series of events that are threatening in terms of health, safety, or well-being of a community or large group of people. In times of crises, education is frequently the first service to be suspended and the last to be restored, by that impacting not only the students' future, but that of their societies as a whole. Education is a fundamental human right and is considered as a top priority. In fact, education in emergencies is essential to help address the physical, psychosocial, and cognitive needs, ensure stability and security, in addition to provide the knowledge, skills, and support needed to survive crises, contribute to resilience, and build a sustainable future. Our aim is to explore novel approaches of teaching and learning that can be adopted specifically by pharmacy schools to deliver their program components in times of crises. Starting with the didactic program components, a timely transition to remote online learning is the most effective alternative to live face-to-face formats, where asynchronous and synchronous settings are often used. Moving to laboratory and simulation program components, although they pose a unique challenge to remote education, however, virtual and remote labs provide a safe, convenient, efficient, affordable, and accessible alternative to traditional labs, removing time, geography, and socioeconomic constraints. Finally, with the experiential program components, pharmacy practice experience courses should be transferred to a remote format, but at the same time, pharmacy schools should participate in alleviating the situation by placing the senior trainees in experiences where emergency and humanitarian pharmacy is needed. A call to action concerning education in emergencies is to develop crisis-sensitive, proactive, innovative, and rapid response plan, empower education and strengthen educational systems, ensure the continuation of accessible, inclusive, and equitable quality education, reduce barriers to education, support frameworks, and finally, identify and engage relevant stakeholders, education actors, and students. Thank you so much for listening, and I hope you enjoyed the rest of the webinar.
Well, thank you, Nasrine, for that, for those insights as well. We wish that you could have been with us, but thank you for doing that video presentation. I'll now turn our program back to Nilhan Uzman for recommendations for addressing inequities in pharmaceutical education. And thank all of our speakers so far. Great presentations and insights. Thank you.
Thank you, Ralph. I also would like to thank our speakers and also all other authors and contributors we had in this toolkit. We have issued some recommendations, but our speakers have already provided some recommendations, some take-home messages for our listeners, participants today. We would like you to leave with some of them in mind, but of course the toolkit has more. So we are trying to give you just a glimpse of the recommendations we issued. And our approach here is there are different roles for academic institutions and policymakers to address inequities, and there are different roles for educators, faculty members, also students to address inequities. So this is the approach we have given. And then we issued recommendations for each team, but I'll start with the general one. And of course, it's important for academic institutions and policymakers, for those who haven't made them, to collate, analyze data to identify the issues around inequities impacting pharmaceutical education at their institutions or practice environments. This is the first step, and we have a tool for that, which my colleague Alison will present in a while. Then we also would like to encourage educators, faculty members, and students so that they participate in the activities, initiatives of their institutions and opportunities in addressing inequities in pharmaceutical education. This is the first step for everyone, actually. And in the next slide, I'll continue with some recommendations for each team, and addressing gender inequities as our first team presented by ISO. And here we encourage academic institutions and policymakers to provide mandatory training and awareness trainings for faculty members, students on becoming more aware on gender-related issues that have implications on education. And then also educators, faculty members, and students develop their own self-awareness regarding these issues, perhaps through receiving such trainings organized by their institutions. In the next slide, I have the racial, ethnicity, and religious inequities. And for academic institutions and policymakers, we recommend them to have a clear and practical diversity and inclusion charter for recruiting pharmacy faculty members. And for educators and faculty members and students, we also encourage them to speak up and advocate for individuals who face racial, ethnicity, and or religious inequities within their education context. In the next slide, we have resource-related inequities, and we also encourage academic institutions and policymakers. So there is an allocation of sufficient budget to education to support marginalized learners, increase enrollment, learning recovery from crises such as COVID-19, increasing socio-emotional well-being of faculty members and students, as well as skills development for employment. It's important to have sufficient investment allocated for education, and we encourage academic institutions and policymakers to advocate for that. And for educators and faculty members, we encourage them to advocate for prioritization, protection, and increase of available resources among vulnerable students and populations in their faculty. In the next slide, I have the final team, education-related inequities, and we encourage academic institutions and policymakers that they empower education that is responsive to immediate learning and development needs, such as COVID-19 or, like Nasrine has presented, humanitarian crises, so that educational system builds resilience and provides life-sustaining physical, social, emotional, and cognitive support. And finally, educators and faculty members should also be requested feedback. Students should collect, feedback should be collected from students regarding their pedagogical needs, experiential and assessment needs as such. So in the next slide, we are here just giving you a glimpse of the recommendations we issued using the resources and contributions we had from our authors. And we try to compile all these findings from the case studies or opinion pieces to provide you with some ways to go, how to address inequities, because we all accept they exist. So we encourage you to visit our toolkit, explore it team by team, and then start addressing inequities at your country, at your region, or support the global addressing of it with FIP. That's all from me. Now I'll hand over back to Ralph.
Thanks, Nilhan, for giving us that good overview of ways that we can address and hopefully resolve these inequities. It's always important. We've identified the problems, and then we have to identify ways forward. So thanks for doing that, as well as our other speakers who have done it also. I think the other thing maybe to add to this is that this could all look to be very overwhelming, because we all don't have expertise in all of these areas, but we have colleagues in our universities who can help us address each of these issues and work with us. So I think it's important to reach out to some of our colleagues who can, within our local environments, who can really help us address these issues and give us some of that expertise. So thanks again, and I'll turn it over now to Allison, who will next present what we can do through self-assessment. Self-assessment is always a very important step in the process to see where we are and where we need to go. So Allison.
Yeah, thank you, Ralph, for giving me the floor again. And just building on Nilhan's presentation of the recommendations of this toolkit, as she has mentioned, self-awareness is one of the ways to promote making a change to address these inequities. So we've developed a tool, a self-assessment tool for academic institutions, policymakers, and educators to support you in addressing these inequities. As a background, and we all know, evaluation of ourselves, our actions, our attitude, or our performance towards different things are critical to the way we would respond and act towards it in future. So understanding and knowing your status on different inequities themes that we've discussed in this toolkit, or that of your institution, would make you a change maker, make you more knowledgeable, and make you champions of equitable pharmaceutical education wherever you find yourself. So this tool, self-assessment tool, intended to help increase awareness, understanding, and status of an individual academic or an academic institution regarding inequities in pharmaceutical education. So we have 8 total tools, 4 based on the inequities theme: gender, racial, resource, and education. So an individual can assess himself or herself based on those areas. Then we also have for the academic institution and policymakers 4 tools still aligned with each of these themes, and you can take the self-assessment for your institution. This will enable you or your institution, as I mentioned, to become more aware of these inequities and also support you with targeted recommendations to address inequities. So the beautiful thing about this tool is when you take the tool, it's really concise. You will finish it in less than 2 minutes. And the questions are like this. This is an example of a question for the institution part. And once you finish filling out this question, you get a response, an automatic response showing you what your score was and recommendations on what you should do. So I kindly invite you to use this toolkit. Follow the link on the screen and in the chat. I know my colleagues will help me to put the links on the chat and take part in this self-assessment. Additionally, you can scan the QR code to take part in this self-assessment. And don't take it alone. Please share it with your colleagues, share it with your network. The more aware we are about these issues and our status, our biases, the more we can be champions for an equitable and quality pharmaceutical education. Thank you. So moving forward, this toolkit is building on a huge campaign to ensure that the issues of inequities are being carried across the globe. So we are inviting you to become a change maker by using the content of this toolkit. We have campaign materials that you can download in chapter 3 of this toolkit. We invite you to share, first of all, share this digital toolkit and the campaign materials that you would download across your social media, with your networks, with your friends. And as I already mentioned, you will use the self-assessment tool for yourself, for your institution, and as well share the self-assessment tool across your network. Then don't just stop at this level. You can take a step further and print the toolkit banner that I will show you shortly and post it at your workplace, in your institution. And this could be your own way of commitment to addressing inequities in pharmaceutical education. And as Ralph has mentioned, and some of our speakers have mentioned, beyond this place, there are needs for advocacy initiatives. So using the content of this toolkit, the campaign materials to advocate with your government and other key decision makers in education on why these inequities need to be addressed. You can use this toolkit as a reference when making your point. We've provided you with lots of evidence on why we need to move forward on. Then, of course, if your institution is already in that place where you are actively achieving an equitable, inclusive, and quality pharmaceutical education, please share the story with us at education@fip.org. We'll very much like to learn how you are doing this, and as well share this with others so we keep doing. And in all this, while you are activating this campaign and being part of this campaign, if you have any success stories, please do share with us at education.fip.org. So here is just showing you how the campaign material looks like. You can see this is for gender inequities, but we have this for the 4 inequities team. And then we have one that comprises all the inequities, which is like a banner that you can print and use at your workplace. And I kindly invite you to go to the toolkit, chapter 3.3, and then click on the social media cards, download them, copy the supporting text that go with them, use the hashtags, post them on social media, and also use it at your workplace. Thank you so much. Here on this slide, you'll see the QR code to the toolkit and the links. I hope you are all able to access this. If you have any challenges accessing this, please let us know. Thank you so much.
Well, thank you, Allison, for that overview and how this toolkit can really help. It's really a nice comprehensive tool. So now we have time for some questions. And Nilhan, do we have any questions outstanding that we need to address?
Currently not in the Q&A box, Ralph, but I got a question from the chat from one of our colleagues. Let me just scroll back to recognize him, Temesgen Mulugeta. Temesgen has asked, mentioned that inequality in pharmacy education is more than any other field of the study, and how this can be improved in developing countries. So, of course, our colleagues have given many perspectives, but is there anything specific that we can get from our speakers in the context of developing countries? Then I also encourage everybody to put down more questions in the Q&A box. This is not for a specific speaker, but perhaps any speaker who would like to respond can take it.
Hello, may I?
Yes.
Hello?
Yes, go ahead.
Yeah, well, I think it has been addressed by the case study I presented regarding the inequalities in pharmaceutical education, particularly in developing countries. A lot has been said with respect to, for instance, infrastructure, technological resources, as summarized by one of the speakers, as a case study in Nigeria. Because as I'm speaking to you, for instance, now, pharmacy schools, especially public pharmacy schools in Nigeria, now we are into their seventh month national strike. No access to university education, no access to the education, the pharmacy schools at all, 7th month. So you can imagine what we are talking about in terms of the duration that you need to spend in the pharmacy schools, for instance, either at undergraduate or postgraduate school level. It's a serious case, honestly. And I think the key strategies to address this has been highlighted in the case study I submitted for Nigeria. It's not only applicable to Nigeria, but to most of the African countries and developing countries as far as pharmacy education is concerned, or education is concerned in general, especially higher education. So a lot needs to be done with respect to the regulatory agency, the Ministry of Education, the other international communities that need to be engaged. It's a serious case, honestly. Thank you. I hope this helps.
Thanks you for sharing that. It's a very serious issue, obviously, in Nigeria. But again, as you say, some of these issues are common among many low and middle income countries. Interestingly, separate from this toolkit, we're having a program at the World Congress that brought to us by members in the Global Academic Leaders Forum to try to close the gap between low middle income countries and high income countries and how we can work together to address these issues. So hopefully more information will be forthcoming.
Ralph, we don't have any more questions, but if, for example, just before we have before move on with our panel discussion, we had done some interviews in the toolkit from regional representatives from different regions and also UNESCO, and we asked some questions to them, and we were asking about whether they have any real life stories themselves that they have witnessed, whether it's a success story or it's a challenge that they have faced in terms of addressing inequities in education. Of course, the case studies that they have presented represent some research, but is there any other real life stories we can get from our speakers, and whether also they have any other recommendations that they would like to make as a result of listening to other speakers today? That could be a question that we could ask to speakers, if you agree.
Yes, I think we have some people. Yep. Yes, please, Dalal, all yours.
If you allow me to share, since Nilhan was describing about if we can share a story. If I can share, we are a pharmacy school in Lebanon, and perhaps most of you know the current multifaceted crisis in Lebanon. And this crisis, together with the COVID pandemic, has seriously affected our school and has adversely affected the country, the students, the faculty, and everyone. I'm happy to share with you that despite all this, our school have yesterday finished a very, very successful accreditation exercise, despite all the challenges we have. So maybe I can say that from our experience for low and middle income countries and countries with crisis and with challenges, that it is never a single or a one-man show. It is always a collaboration. There is the school itself, the educational system, the pedagogy system. There is the support from the administration. There is the funding that everyone will need in order to achieve equitable environment and quality education. So it is never a one-man show. You need collaboration from the educators, students, from the administration. You need funding and you need support in order to be able to achieve equity and to maintain the quality of education. So it is always a collaborative effort.
Yes,
So
very
just
good
like
point.
to share this with you.
Yes, yeah, good point. It's a team effort.
Thank you.
For sure. Yeah.
Yeah. Yeah.
Okay, how are we doing on time? Who's keeping time? Allison, Nilan? We need to leave time for our panelists, so maybe we should move on. What do you think?
I agree. I think we should move on with the panel.
Okay.
Thank you.
So it's our final section of today's event is a panel discussion. And so our panelists today, shown on the screen, do we have there? Go to that slide, please. So our three panelists are first our CEO of FIP, Dr. Catherine Duggan, a longtime pharmacist and pharmacy advocate in the UK, and she has brought a tremendous amount of new ideas, new programs, and new energy to FIP. And the rest of us in FIP just simply try to keep up with her. Very energetic and very great at generating ideas. So welcome, Catherine, to our panel. Our next panelist is Dr. Oliver Grundman, who's clinical professor at the College of Pharmacy at the University of Florida in the United States. He leads 2 international graduate programs in pharmaceutical chemistry and clinical toxicology, and holds a Master of Education degree in curriculum and instruction. So welcome and thank you for joining us, Oliver, and for your other work on the toolkit as well. And we're also happy to welcome Ms. Karima Benara, who is a recent graduate from Algeria and is a global health enthusiast and pharmacy education advocate. She has served for the past 2 years as the International Pharmaceutical Student Federation chairperson of pharmacy education, and is currently the early career regional engagement supporter for the Africa region at FIP. So we have some questions for our panelists, and we'll begin with a question for Catherine. And that is, what is FIP's perspective to achieving equitable education globally, and why is that important?
Thank you so much, Ralph, and for your kind words at the beginning. I'm very proud to be part of the panel today, and I've been very interested to listen to the previous presenters. So, Ralph, you know this entire issue is of huge importance to FIP. Our FIP-wide vision is about how we would ensure access to all for medicines and devices. So you could extrapolate that our vision for education in its entirety is to ensure access to education and professional development for all. You could say that we advocate universal pharmacy education coverage. And I would say without good education, you have no professional leadership, no professional development. And as has been said, the standards of care would suffer. Then, of course, Ralph, the question is, how can FIP support and enable our colleagues globally, then more impactfully regionally, nationally, and even locally? And the toolkit goes a huge way forward to do that. But we also have a few other strands and programs of work that support everything in its entirety. And I think it's always very, very useful to summarize these things so that we keep in mind things that we've already done or things that are underway. So firstly, the FIP Pharmacy Education in Sub-Saharan Africa report, one of the ways forward areas of the report was exactly this issue, addressing inequities in pharmacy education. Secondly, other ways forward include establishing more educational partnerships in higher education. Ralph, we know you can't do anything alone, or if you do it alone, it takes you much longer.
Exactly.
Secondly, establishment of an African Pharmacy School Association, the expansion in our minds of the FIP Unitwin program across other regions. All ways forward will contribute to addressing inequities in education. And FIP's positioning in Unitwin as our core program to facilitate these ways forward, that's already in progress with UNESCO. So I think, Ralph, we have to do a lot of things to count towards this major issue. Then thirdly, the FIP Global Call to Action on Pharmaceutical Education is our guiding framework, which maps with all our development goals, and the call to action is our roadmap in achieving equitable, inclusive and quality pharmacy education. And this is going to be, it's super important, always has been, but even more important as we emerge out of the pandemic, for the development of competent, adaptable and flexible pharmaceutical workforces nationally, regionally and globally. And then, Ralph, we have the fourth area, the FIP development goal number 10, equity and equality, and our program that aligns to that in the context of addressing inequities in pharmacy education also includes access to education in that. And the three elements that sit in that goal include workforce, where we need to support clear strategies for addressing equity and diversity and the inequalities in our workforce development, as well as continued education and training and career progression opportunities. Secondly, there's education. Having clear strategies for equity and diversity in pharmaceutical education delivery ensures that everyone has access to quality pharmaceutical education. And science, that we have equity and global capacity of pharmaceutical sciences training, research infrastructure, development and manufacturing. And Ralph, I think these things, if they were in a slight, perhaps a slight shade in recent years, my goodness me, the pandemic has shown that those three areas of that development goal number 10 are hugely important.
Yes.
And then, Ralph, we have the UNESCO's 2021 Global Education Meeting, the Paris Declaration, a global call for investing in the futures of education. That's a really important place where we can demonstrate, advocate, and proclaim our support. That declaration is the global call for investing in futures of education. It expresses strong commitment to investing in education for the future of humanity and the planet. And actually, many of their declarations and their commitments are relevant for FIP. And there's three that I'll just highlight for us today. That is that we urgently need to tackle the educational crisis and inequalities exacerbated by the pandemic. We need to realise the importance of multilateral cooperation, multi-stakeholder engagement in advocating education, and we need to invest in key policy priorities for recovery and accelerated progress towards SDG 4. So, Ralph, there's a lot of ways in which we can demonstrate or align to make sure that pharmacy really, really steps up and uses all the strands that we have to pull together to actually build towards less inequities. Ralph, I would say a lot of this has been done under your stewardship, not only as FIP chair, but also in leading the Unitwin program. I commend you for that. And I also think we all need to be aware that as soon as you address one inequity, another will pop up. This is the nature of our work. It's not about being 100% successful at one point and then ignoring it. This is step by step by step by step. So, Ralph, I really think today's toolkit is a splendid advance to support colleagues globally in their self-assessments and then doing something about it. But also what we're doing needs to grow louder, be stronger and more impactful. Thanks, Ralph.
Well, thank you, Catherine, for that great insight into the FIP programs. And I think, the important thing, message to me is we have to work together on this. Going it alone is a very, very tough road and a very long one, but I think working together and learning from each other and how we can move the forward on these inequities is really important. And again, as Catherine pointed out, we have a lot of programs in FIP that foster that partnership and the networking that's needed at various levels, from leadership to faculty to practitioners and so forth. So, so I'll put a plug in for joining FIP here and participating in all of these programs that we have and working together to address these issues. So thank you, Catherine. We'll move on to Oliver now, and question for you as an educator, faculty member, what are the challenges in achieving equitable pharmaceutical education and some solutions to those problems?
Thank you very much, Ralph, and everybody. I'm honored to be part of this event and also contribute to the FIP toolkit together with my co-authors. I think the realization that pharmacists are among the most accessible healthcare professionals is important to also realize how inclusion, diversity, and equity are essential to our profession. And many of the other speakers today have already highlighted how important it is that we train and prepare our future graduates for that role that they play in diverse communities, knowing and addressing the inequities in access to healthcare that exist. In order to do that, I think important is that we realize that students, as has been mentioned before, students want to be able to relate to their teachers, to their instructors, and we need to ensure that we have adequate representation among faculty to do so. Otherwise, we are falling short of our goal to educate appropriately. I think it's important to also include in the curriculum that health inequities are a reality, that we have population differences in terms of healthcare access, in terms of healthcare resources, that takes different dimensions. If it's socioeconomic resources are lacking, if it is the degree of health literacy that exists among the community, and engaging with the community as a practicing pharmacist is important to understand better what are the current shortcomings. In terms of faculty, as has been said and advocated for before, there are certain leaders among faculty that really take the lead when it comes to facilitating and moving forward in the IDE space, in the inclusion, diversity, and equity space. But ultimately, it's really a teamwork, as has been emphasized multiple times. It is important that administrators and leaders are on the same page, that they are moving the needle forward to both facilitate diversifying the faculty membership, recruiting and reaching out to minority students or those who are not adequately represented in the profession of pharmacy. If this is based on racial and ethnic differences, if this is based on religious differences, if this is based on gender differences, we need to address it. Otherwise, we are failing as an institution, as a profession, and also in failing our patients in the end that we have to serve in the future. I think making it really a priority to look at the curriculum and make sure that we can incorporate where it is necessary important elements of health equity or inequities in healthcare access is important to raise awareness, to educate our students in that field. So I think that is very important in that regard. I hope I was able to kind of encapsulate what you were asking and addressing that in my answer. Thank you.
Great, thank you, Oliver, for that perspective. And yes, it is a team effort on the part of the faculty administration of academic institutions and to address these issues. One of the things that I think I would add to this is the necessity for us in academia to develop pipeline programs amongst those who have limited access and need the opportunity to come into pharmacy education, that then helps us develop the next generation of academics. And I think your point as being the most accessible healthcare provider is so critical, and we have to meet people where they are, and they have to see people who look like them and come from their backgrounds. And I think this is really important. So I think we've got to pay a lot of attention to developing that pipeline from younger learners all the way up to graduates of our program. So thanks for that, those insights. Very, very good. And finally, last but certainly not least, is for a question for Ms. Karima Banara, our representative from the International Pharmaceutical Student Federation. As a student, what are the challenges in achieving equitable pharmaceutical education, and what might be some solutions that students have thought of to address these issues?
Okay, thank you so
Always
much.
important to look to the younger generations because you guys have great ideas and energy. So thank you for joining
Thank
us.
you so much for all the constant support to IPSF and to all our projects. When it comes to challenges and to solution, when it comes to equity in pharmaceutical education, I believe, as all speakers already mentioned, that yes, inequity in education is one of the most serious problems worldwide, and it has multiple causes and factors that are most likely to be the challenges in achieving equitable education. And as we all agree that COVID-19 outbreak in 2020 not only shed light and amplified existing inequality, but it has also provided an opportunity to all of us, especially students, to rethink education, in particular for vulnerable students. And speaking from a student's perspective, as regards challenges, I believe that there are three major areas to highlight here, starting with but not limited to accessibility to learning, and how it is challenging to have and secure enough resources by universities to students to access learning devices, tools, and even opportunities. The second thing would be quality of learning, which affects students' motivation to keep on learning, and also having students prepared for self-directed learning. That's what we saw from COVID-19, and the ability of us as students to cope with potential disruption and expected and unfavorable conditions. And the last and the most important point I would highlight here is student mental health and well-being, and the ability to give and provide students with the needed support to manage stress, anxiety, their access to medical attention and care, not only during the COVID period, but throughout the curriculum period. And the most important is how it is challenging to always understand and to keep on schools as not only a place of learning, but also as a safe and a protective place for all vulnerable categories. When it comes to challenges for me and from a student's perspective, I believe that the solution starts from us, because we as students need to learn and to understand the difference between equity and equality.
equity, and that they are not the same thing, as equity means providing the same resources to everyone, while equity means to provide the necessary support to the one in need. And I think that we as students need to advocate for better, improved, and equitable education, speak up for better outcomes, and that's by trying to be more involved and engaged in the process of making change, call for action, and have a solid plan to affect and reach policymakers. We also need to be integrated and work to have strong evidence to base our advocacy plan. The second thing, or the second area for the solution, I would think that we as students need to be giving feedback in all processes and to take part in all the provided solution, maybe highlighted here, for example, the integration of technological and digital in the curriculum or in the whole process, as well as focusing on other like other conditions such as the economical and social factors, not only because they are one of the most reasons affecting the improvement of the educational system. Yes, that's from my side. Thank you so much, and looking forward for the question. Thank you.
Thank you, Karima. Great insight from the student perspective. I'm going to highlight the one area that you talked about in terms of advocacy. Students at my school have participated in advocacy efforts, and I am absolutely certain that our policymakers listen more to the students than they do to us, who are the teachers and the administrators of academic institutions. So I think that role of students in advocacy is really very important. So thank you for bringing that up. I think that's great. And it's one of the solutions to addressing this problem for sure. So thank you to all of our panelists. I think we're running a little over time. I thank everybody for sticking with us, and we're almost to the end. So some final words. If we can go to the next slide, please. So we are happy and excited to invite you to the return of the in-person World Congress for FIP. It's the 80th FIP World Congress in Seville, Spain. Nice place to visit. And it'll take place from the 18th to the 22nd of September under the theme of Pharmacy United in the Recovering of Healthcare. Registration and abstract submission already open, and for more information, you could go to seville2022.fip.org. If you just go to the fip.org website, all the information will be there. So for those who can join us, that would be great to see you there. And again, a great networking opportunity for helping to address these issues. The main themes of the program are never waste a crisis. This is always a good thing to remember. And these are learnings that we've gotten from the past several years of the pandemic, and how we can learn to prepare for the future. Science and evidence supporting the response to COVID-19 and dealing with new and extraordinary ethical challenges. It's going to be a very interesting program. I'm looking forward to being there myself. So please join us if you can. All future and actually past FIP digital events can be found at events.fip.org. So if you've missed some past events, you can tune into those or see what future ones are coming up. There have been a tremendous number of the digital event programs by FIP addressing many different issues, some related to COVID, others more long-term type of issues. But just tap into the resources that FIP has. And finally, I'd like to thank again all of our speakers, our panelists, our FIP staff who organized and participated in this event. Thank you to the participants, the attendees for joining us today, and in the chat providing some of your ideas and issues that we can learn from as well. I think we all learned some new ideas and ways we can move forward to address inequities in pharmacy education. I think we've got a pretty clear idea of how this toolkit can really help us individually and collectively and through our networks to help address these inequities and move things forward for all of us. Again, you can access it here through the QR code or the website as shown on this slide. With that, we end our event. Wish you a good day or evening wherever you are, and enjoy the weekend that's coming up. So with that, I will say goodbye to everyone. Thank you again for joining us. And let's look forward to working together to address these issues. Any last comment, Allison or Nilhan?
No, thank you, everyone. Thank you for joining and staying with us. Thank you.
Thank you very much.
Have a nice weekend when it comes.
Bye-bye, everyone.
Bye, everybody. Thank you.